Good morning. Well, I'm going to explain about neonatal hypoglycemia studies. Is there a sweet story of success yet? Catholic University Faculty of Medicine. I'm a student of medicine. My name is Rudy Solange, and here I put some links where you can find more information and press presentations. We're going to start with a definition. Neonatal hypoglycemia defined as a plasma glucose level of less than 30 milligrams per deciliter in the first 24 hours of life and less than 45 milligrams per deciliter thereafter is the most common metabolic problem in newborns. Here we can see a video when the doctor explained about the hypoglycemia.
Hello everybody, I'm Praveen, a neonatologist at NCRI Neonatal Network. Today I'm going to talk about an important condition called hypoglycemia of newborn. Hypoglycemia is a condition where the blood sugar level in the newborn tends to fall down. Normally, once the baby is born, they are separated from the mother and the cord is clamped. The glucose supply from the mother to the newborn is interrupted. Hence, the sugar level tends to fall down. However, as soon as the baby starts to feed on the mother, it tends to normalize. Hence, we recommend as soon as it is possible, once the baby is born, they should be fed on the mother. In conditions where mother is not able to feed the infant, formula feeding should be done. The symptoms of hypoglycemia are shaking or trembling of the limbs, which is called as a jitteriness. They can be very lethargic, may not be interested in the feeding. They can cry incessantly or become very dull. They might have breathing difficulties or pauses in the breathing, and also have bluish discoloration of the fingers and toes. Some babies are at higher risk of developing low sugars in their blood. These infants are either born to mothers with diabetes or have a condition called intrauterine growth retardation, or premature infants, or the infants with infection. The babies who are at risk of developing low sugars are screened by the way of blood tests at regular intervals to identify the low sugar levels early and institute the treatment as soon as possible. The first line of treatment would be encouraging on mother's milk or giving the formula feeding. However, in some infants, the sugar level would not normalize even after milk feeding. They would need to be admitted in the newborn unit, monitored closely, and might need glucose infusions through the veins. Some of the newborns might need medications to stabilize the blood sugar level. Brain needs constant supply of glucose. Hence, any conditions where the blood glucose level is low can affect the functioning of the brain, and when it is very severe, can lead to fits or seizures or even long-term neurological abnormalities. Hence, it is very important that babies who are at risk of developing low sugars should be screened regularly and glucose should be normalized as soon as possible.
Well, it was video and the doctor explained some factors that can influence in the neonatal. We're going to continue with the exposition, and now I'm going to explain the possible consequence. Major long-term sequelae include neurologic damage resulting in mental retardation, recurrent seizure activity, developmental delay, and personality disorders. Some evidence suggests that severe hypoglycemia may impair cardiovascular function. Now we're going to see another video, another interesting video. Well, the doctor is going to explain more about those terrible possible factors cause of the hypoglycemia.
Hello, my name is Peter Stefanovic. I'm a lawyer who for the past 20 years has specialised in medical negligence litigation. I'm going to talk to you today about hypoglycemia in newborn babies and the serious harm that can be caused to a newborn baby when medical staff fail to recognise hypoglycemia and take appropriate action to reverse its effects quickly. Hypoglycemia occurs when baby's blood sugar, often called glucose, is too low. Glucose, you may know, is one of the body's main sources of energy. Some babies are more at risk of hypoglycemia than others. For instance, babies born to mother with diabetes. Other risk factors for hypoglycemia include babies born prematurely or too small, babies born with breathing difficulties, babies who suffer from excessive coldness or hypothermia, and babies who have infection. Provided hypoglycemia is recognised and steps taken by medical staff to reverse it quickly, it's unlikely that harm will be caused to the newborn baby. The only way to be sure is for there to be blood tests. There might be outward signs. For instance, baby might be jittery or irritable, or might be floppy or sleepy. In cases of very low blood sugar, baby might suffer from fitting or even convulsions. That would be a medical emergency, and staff must act quickly to avoid serious harm, including brain damage being caused to the newborn child. Where medical staff fail to recognise hypoglycemia and take appropriate action to reverse its effects, and a baby suffers harm, including brain injury, there may be a substantial claim for compensation against the hospital concerned. I recently acted on behalf of a family in just such a case. What made the case so interesting is that it had already been investigated by another lawyer who had advised the client not to proceed with the case and that it should be abandoned. That lawyer had obtained a report from a consultant obstetrician and gynecologist who had in fact concluded that there had been a negligent delay in delivering the baby. He had then quite appropriately obtained a report from a consultant paediatric neurologist, that's a children's brain injury specialist, to provide an opinion on causation. That expert, however, had concluded that it was impossible to link the baby's brain injury to the negligent delay in delivering the child, and it was on that basis that the lawyer had advised the client that the case should be abandoned. When I looked at this file, what concerned me most was that none of the experts instructed seemed able to explain exactly how the baby's brain injury had occurred. I therefore concentrated my investigation on what was happening in the early neonatal period, that's the days immediately following baby's birth. On reviewing the notes, I found that baby had had consistently low blood sugar. I therefore instructed a consultant paediatrician to provide a liability report, and he concluded that there had been a negligent failure on the part of the medical staff caring for the baby to recognise hypoglycemia and take appropriate action to reverse its effects. I then instructed a new consultant paediatric neurologist who concluded that it was as a direct consequence of that negligence that baby had suffered brain injury. I presented the case to the hospital trust, who predictably initially denied the claim. Court proceedings were issued and the case eventually settled, with baby receiving a multi-million-pound damages award. Where you believe a child has suffered harm as a consequence of a negligent failure to recognise or treat hypoglycemia in the newborn period, there may be a substantial claim which can be brought against the hospital. Such a case should always be investigated by a lawyer. Thank you.
Now we're going to continue with the presentation. And we have the signs and symptoms. Infants in the first or second day of life may be asymptomatic or may have life-threatening central nervous system. And cardiopulmonary disturbance symptoms can include the following. Pay attention: hypothonia, lethargy, apathy, poor feeding, jitteriness, seizures, congestive heart failure, cyanosis, apnea, and hypothermia. Now we are going to see a video that is like a representation about a situation of a mother with his or her baby that have hypoglycemia.
Is everything okay? No, my baby won't stop shaking. I don't know what to do. Okay, let me go ahead and see him. I'm going to hand him over to the nurses so they can start looking him over. We're going to find out. We're going to take good care of him. Don't worry. Can you tell me a little bit about what's going on with him?
He's just really irritable and he won't stop crying and he's shaking really bad. I don't know what to do.
Okay. And has he had any wet or soiled diapers today?
He's had about 2 wet diapers and he's only had one spoiled diaper.
Okay, and what about breastfeeding? Is he breastfeeding okay?
No, we're having problems. He's only taking each for a couple minutes. That's it.
Okay. And when he takes that, is he latching on all the way, or is he just not wanting to eat, or?
I don't know. I don't think he's like well because it really hurts.
Okay, we'll go ahead and have a seat. The nurses are doing a great job looking over him. They're gonna finish up checking a few things, and then as soon as we have some information, we'll let you know what's going on. Okay?
Please take care of my baby.
They're doing a really good job. We'll take the best care of them that we can. Okay?
Thank you.
Good morning, nurses. What do we have going on today?
Yes, doctor. Mrs. Scott here, with her child, James, and here during a testimony, saying that he was a little bit jittery and lethargic, and also tired.
The vitals are respirations were 56, the heart rate was high at 162, BP was low and temping 96.5.
Scott, don't worry, we got the 18 on your baby. We got some good stuff, and we'll go slow for a while. Good. AccuCheck for me, please.
Absolutely. What's an AccuCheck?
Take the heel of the baby. You're going to draw on a little bit of blood. We're going to see how much sugar is in the blood. That's the worst. If you now die, it's not long-term check.
Please take care of my baby.
Is that the
Blood glucose is 36.
okay, it's a little low. It's and we're going to run the other test. I'd like you to feed the infant and the older.
Now, as we can see, the doctor is analyzing all the procedures that the nurse made with the neonatal instead of make his diagnosis.
You got the 18 with it? Okay.
Thank you.
Nurses, what's the result of this patient?
I guess, doctor.
30 minutes later,
The respirations were 40. Heart was at 138.
We went ahead and we ran the AccuCheck again, and the result was 48.
Wonderful, thank you. Mr. Scott, I told you we checked out
the doctor is taking a continued control with the neonatal, evaluating all the signs and symptoms that the neonatal present. Now the doctor is explaining the mother what happened with his baby.
I do have one concern, that when baby is breastfeeding with you, it's not getting the proper amount of nutrition. So if it's all right with you, I'd like to have a lactation breastfeed with you. And they'll go over some coaching and some teaching. Would you be okay?
Yes.
And I'm also going to give you a form. I'd like to have the nurses give Sammy a shot for hepatitis B. It's a standard procedure shot. Any questions about it?
Does my baby have hepatitis B?
No, it is actually a vaccination, so he doesn't get that. He doesn't get hepatitis B down. Give you a form, it's all right. Go ahead and give him a shot. That's all right.
Yes.
We can just Yeah, the 18. Okay, what I'd like to do is the second one, give a shot for hepatitis B. Let's go with 10 micrograms prior to discharge. Any questions? Thank you very much.
Hi, Scott. I need to do the sinus business form because I've had accident.
Okay. Hi, Ms. Scott. My name is Crystal. I'm a lactation nurse today. I just wanted to go over a few things to help you feel more comfortable breastfeeding. I was going to teach you about a few positions. There's a couple of different positions you can choose from. There's one that's a cradle hold where you can just hold him, on your arm with his head to your breast. There's also the football hold where he is laying between your arm and then his head is right at your breast. And then there's a sideline position, if that's more comfortable, where you're laying sideways in the bed and you have him laying next to you, and you can attach that way. You want to make sure that he has a good alignment with your breast so he's able to latch on easily. The best time for him to latch on is right when you see his mouth open. You want to just quickly stick your whole breast in his mouth. You want to make sure that your nipple and your whole areola is in his mouth so he gets a good
So the
latch.
doctor recommends some procedure, but now, as we can see, the nurse is
And
making.
then you want to listen for an audible swallow. That means that he's getting, a good flow of milk and he's has a good latch. And then just also monitor his output. You want to check for 6 to 8. You want to check for 6 to 8 wet diapers a day, and you want to check for, you should be having at least 1 to 2 soiled diapers a day. He's stable right now. They went ahead and gave him his bottle. His blood glucose is back up. It's looking good. If you have any questions at all or anything, let us know. Okay, you're welcome to go back to your room and just keep a hold on for the next couple of days. Okay?
Okay, thank you so much.
All right, do you have any questions?
Not right now.
Okay.
I'm just so happy my baby's okay.
Yes. You're right, you're welcome.
Ready? Okay, nurses, what do we have here?
Yes, we did some vital signs.
We can see the
FLB.
loopers.
Got the ugliest baby
As
I've ever
I
seen.
told
Slap
you,
him.
it
Think
was
twice.
like a representation
Give the Hep B
about
shot.
a situation of the neonatal. So now we are going to continue with the exposition. The treatment, surgery. If hypoglycemia is diagnosed in an infant younger than 3 months, surgical intervention may be necessary. Surgical exploration usually is undertaken in severely affected neonates who are unresponsive to glucose and somatostatin therapy. Near total resections of 85 to 90% of the pancreas is recommended for presumed congenital hyperinsulinism, which is the most commonly associated with an abnormality of beta cell regulation throughout the pancreas. Risks include the development of diabetes. Now we are going to see a procedure in a baby. This procedure is very invasive.
Tiny babies become bad when their blood sugar goes down. When sugar goes below 50 milligram per deciliter of blood or 100 ml of blood. At such times, give 2 ml of 10% dextrose per rectum as seen here. Baby is 2 kilos, then you give 4 ml. Give it slow with the help of a tube. If you don't have a tube, you can just put a syringe and push. This increases blood sugar from 50 to about 100 and keeps there for about an hour. This will save many babies. This is treatment of hypoglycemia, major cause of child deaths and child morbidity, that is child sickness. Try this, tell all. It needs no syringe, no needle, no pricking. Easy, anybody can do. Thanks, tell all. Dr. Heman Joshi, Virar. See our website www.drhaj.com. See our videos on YouTube. Look for Dr. Heman Joshi at YouTube. Thank you.
Thank you too. So the medication. Cortisol should not be used because it has minimal acute benefit and may delay diagnosis of the cause of hypoglycemia. Cortisol stimulates glucogenesis and causes decreased use of glucose, which leads to overall elevated blood glucose and may mask the true cause of hypoglycemia. So, pay attention with the recommendation. Don't use cortisol. And we finish our presentation. Thank you.